How do you feel about aging backwards? Literally. How do you feel about breaking all the rules that other people expect to occur and happen when you age? The creaks, the aches, the pains, the potentially the weight gain because of the aches and pains that might slow you down and prevent you from doing activity and living the life that will help you avoid the weight gain. All things we're going to talk about today. And today, I'm so sorry. I'm so sorry that we're not doing video because my guest has a face for video and she's a walk in the talk. So she's literally using and applying in her own life what we're talking about today. And if you've thought before, this is for celebrities, this is for professional athletes, you're going to find that's not so much true. And in the very end, I challenge your thought process because I'm challenging my own. And I think this is an episode that you're going to love and be open to. So strap on, lace up your shoes, get ready. If you've got a commute coming up, this will be a good one. I'm Deborah Atkinson. You're listening to Flipping 50, where I address your top struggles and concerns, and I share what to eat, how to move, and how to change your mindset so you can have the energy and vitality that you want, need, and deserve in this second and better half. This episode is brought to you by the Flipping 50 Menopause Fitness Specialist. It's the course that designates a trainer or health coach specifically as a menopause fitness specialist. So whether you are coaching women on their exercise or you are a trainer actually working with them and designing the specific exercise that they're doing each and every session, it will help you support hormone balancing exercise prescription and throw out the old position statements and guidelines that don't fit. And it was designed by me, the founder and creator of the first and the only exclusively made for menopause fitness membership in the world. And I'm giving you the keys to the kingdom. I'm giving you the systems and the methods that I've used to help hundreds of thousands of women flip 50 with the energy and vitality that they want. So what are you waiting for? I'm going to put the link to the specialist information in the show notes today. Let's dive into this episode. My guest today is Dr. Joy Kong. She's a UCLA-trained, triple board-certified physician, anti-aging and stem cell specialist, educator, and CEO. As the founder of Thea Center for Regenerative Medicine in California, she focuses her efforts on prevention of aging decline, as well as chronic and degenerative conditions that no one else has been able to heal. Dr. Kong believes that complete healing can only come from looking at the whole person, mind, body, and soul. And this has allowed her to address the root cause of health issues and lead her patients to fuller, more vibrant lives. Dr. Kong, thanks so much for joining me.
You're so welcome. I'm really happy to be here with you.
Well, I can't wait to dive into this topic. So it's relatively new to our listeners, and I want to unpack all that. But I'd love to know, for you personally, why stem cell therapy? I mean, you could have done 100 other things. Why this?
Yeah. What's funny was, as a medical student, we really weren't taught very much about stem cells at all. So I thought stem cells are still in at their infancy, that it's still in research. No one was using it. I mean, I probably majority of the doctors, well, that was 5 years ago. Maybe now a little bit more doctors know that stem cell therapy have been used. But at that 5 years ago, I really had no idea that people were doing stem cells. I mean, it's pretty sad, right? So at that time, I was board certified in two specialties, psychiatry and addiction medicine. And I was so with blinders on that I didn't know what was going on outside of my, kind of psychiatric addiction field. So not until I met this doctor who was really excited, and he started telling me about anti-aging medicine, which I've never heard of. Was that, what's that? And he was telling me, well, you can optimize the body so that you can prevent aging. There are many things. Holistically, as a person, we decline in many aspects. So if you can address all those aspects, you don't decline, and then you don't age. So of course we're still going to age, but you're much slower in pace. And then he said, look what I did for this kid. So he pulled out this his cell phone with a list of changes that was observed in this autistic kid he treated with stem cells. And my first question was, what, you can use stem cells clinically? And he said, yeah, I use umbilical cord derived stem cells, and I give it to this autistic kid. Look at all these changes the teachers noticed. So the teacher noticed about like 40 changes, from better social interaction, better concentration, able to hand in homework, playing better with kids, and just 40 things. So you can imagine, I was very impressed, because being trained in psychiatry, having seen a lot of autistic kids, I knew how devastating condition is, how difficult it is to treat, and how traditional psychiatry were treating it, not by reversing the root causes, but by subduing the child. So most of the medications, including antipsychotics, there may be some stimulants, maybe to help them focus a little better, and there are kind of anxiolytics. All these medicines that we were giving adults, and we're just using them in microdoses to kids. We're really just trying to calm the kid down, or even to shut them down. So to see actually the kid was able to have a transformation, actually was functioning better, was improving in all these areas that parents are looking, for improvements in, with a simple one stem cell treatment. I was, my mind was blown. So I thought, okay, this definitely, this is something's in this. I need to understand how this works and why. So that's what started it. And when I started actually open my mind and read the scientific articles that are around, and I realized there were a lot of research being done, and a lot of people have been treated. And that's, what's funny is now I reflect, because, I still have my patients who go to their primary care doctor or whatever specialist they go to. And they say, well, I want to do stem cell therapy. And one of the typical response from these doctors was, well, yeah, it sounds great, but there's still not much evidence that it actually works. So it's funny. They were kind of where I was. They just didn't know. They didn't know that there were tons of evidence already out. So that's a story of how I got intrigued by stem cell treatments.
So good. Okay. For listeners, let's start with the ABCs, not assume anything. First of all, what are stem cells and stem cell therapy?
Yeah, I always tell people, just think of yourself. You came from a single stem cell, the fertilized egg. So what's in that single cell, that stem cell, that allowed it to divide, to form different shapes, to migrate to different spots, and to form all these complex structures that form an entire human being? What kind of intelligence that's in that cell, in that DNA that's in that cell? So the power in the cell is intelligence. And the intelligence is embedded in this DNA. And DNA is the most energy dense substance in the universe. So what I tell people is that the stem cell is really the engine for life. It has the blueprint for life. But when people look at stem cells, one thing that they don't realize is that there are many, many kinds of stem cells. So when the first fertilized egg has so much potential, it can form a whole human being, including even the sperm and egg that's in that new human being. So, and that stem cell would divide into a ball, and any one of those balls, those little cells, can be extracted and used for therapy. And those are called embryonic stem cells. So that's one type of stem cells. But those cells will continue to divide. Like I talked about, they form different shapes, they migrate, they start to differentiate. So all the way along, they are becoming different kinds of stem cells. They will gain a specialty and lose some of the generality. So it's almost like, from a general practice cell, you become a specialist cell. So you're becoming more and more specialized. As you specialize, you lose more potentials. So one example is what's called hematopoietic progenitor cells. So these are stem cells in your blood that can become any cell within the blood system. So white cell, red blood cell. So they can become any of the cells floating in the blood, but they can't do anything else. That's their role, but they're a stem cell. So you can imagine going from being able to become anything to becoming much more specialized. You're still a stem cell. So what's a stem cell? So one of the characteristics of stem cells is that they're able to replicate and replenish themselves. And when they replicate, they will divide into an identical copy of themselves and a daughter cell. So this daughter cell would have gained function. So it will be more specialized. So that's how they divide. And then they can replenish the tissue that they occupy. So the stem cells, as they divide, they will start to have functions that are really unique to their own. One example is what's called mesenchymal stem cells. So these are very interesting stem cells that's all over our body. Maybe a little different than other stem cells because they really have this overall almost like a conductor in a symphony of regeneration. So they have this overall monitoring effect, but they can still divide, replenish themselves, and can divide into a further more differentiated cells. But the body is a very complex system. So in your local tissue, like your liver, your lungs, there are stem cells, but they are tissue-specific stem cells. All they can do when they divide is to form a liver or a lung cell. So that's all they can do. So these are some of the differences and steps of evolution for stem cells.
Fascinating. Okay, I feel like I could probably pelt you with questions all day long. So I'm gonna try to get this and bring it to listeners. So who's an ideal candidate for stem cell therapy? What are the wide gamut and range of things that can be helped by stem cell?
Yeah, since stem cells is what made life, it's always going to be here, and stem cell therapy is here to stay. So I tell people, it doesn't matter what the government is saying, what the medical establishment is doing, doesn't matter what the pharmaceutical company is saying. These are the secrets that make life. So I believe one day stem cells will be so commonplace. It's going to be like antibiotics or like aspirin, whatever most common things we use these days, that people are going to take it for regeneration, for prophylaxis. So will prevent you from declining, from getting sick, from getting even helping your body to be much more agile so you can prevent injuries. So as a baseline life enhancement. And then when you get sick, you can get stem cells, whether or not you have a physical injury or an infection, or you just had an operation, you can infuse more stem cells and that will help you heal. So it's going to be just a foundational aspect of medicine. So as far as what people can be helped, literally anybody can be helped because what we're using, at least what I'm a proponent of using birth tissue. So yes, there are embryonic stem cells that are very primitive. The problem with embryonic stem cells or even induced pluripotent stem cells. So that's another form where they can induce an adult cell to become go back to an embryonic state. It sounds great. The practical problem is that these cells are very wild. They have so much potential that they can become anything, any cell in the body. And what often happens is that they will form these uncontrolled ball of tissue of all kinds of tissue, hair, teeth, nervous tissue. I mean, it's really crazy. But that's what happens. And women have had this, right? They had teratoma. Instead of forming a fetus, they form this tumor. And what happens is that in stem cell treatment, when people have used these type of cells, that like somebody had a tumor, after stem cell injection, there's a tumor in the back. So that's a problem with embryonic stem cells. But adult stem cells, which anybody that, after birth is considered an adult. This is in the embryology kind of terms. They are adult. So even if you're a 2 days old baby, your cells are considered adult cells. So the adult stem cells has less potential. Of course, the older you get, the more they lose their intelligence, they lose their potency, and they lose their capability to recognize cells that should not be there. So they can, if they don't recognize, let's say, cancer cells, they can keep producing signals that allow everything to grow, and then the cancer cells can grow as a result. So the adult cells has its disadvantage. So what I use is birth tissue derived stem cells, which is really fascinating intermediate cells between embryonic cell and adult stem cell, because it contains some of the characteristics of embryonic stem cells, but it can't go wild anymore. It doesn't have the risk of producing teratoma, but it's so young. It has longer telomeres, has more generations left. It produces more anti-inflammatory factors. It's just overall much more powerful cells comparing to our adult stem cells that you can obtain from bone marrow or fat. So with these cells we use, it has been used for people of all ages, for everybody, even for kids with cerebral palsy, autistic little kids, brain damages. You can use the cells to help them repair, and of course, various conditions. People always ask me, what can stem cell treatment help this or that? They can have, let's say, COPD or liver cirrhosis or psoriasis, so all kinds of problems. And my first thing I do is to give them research stats. I tell them what research has found in that condition, because I don't make any claims. Every decision I make, every statement I make is based on research. So if in most common conditions, because I founded an academy, American Academy of Integrated Cell Therapy, I teach a lot of physicians on stem cell therapy. So they actually take home over 300 articles, all categorized by organ systems and disease categories, from head to toe, over 30 categories. So there's a lot of research, for all these different systems. So I will tell them, whether or not there has been research done in that particular condition. But if it's a more rare or obscure condition and no one has put the money in to study it, I look at what caused the disease. If the disease has any as part of the formation of the condition, if there is inflammation, that's part of the picture. If there's immune dysregulation as part of the picture, so you can look at autoimmune diseases or any degenerative conditions, inflammation is a big part. So even for hereditary genetic conditions, I can't fix the genes, but what I can fix is the immune dysregulation or downstream tissue damage and inflammation as a result of that genetic change. So I can help on that level. So all these other people I can help. And besides problems and illnesses, I can help prevent people or slow down their aging process. And that's one lecture I've given at different conferences about stem cell therapy as an anti-aging tool. And it's not just, what I think that it may help with. It's proven by research, because research have not only shown, doing stem cell therapy, looking at people's improvements in their, hair, nail, energy levels, sex drive, but they've also done studies on like neurotransmitter levels, growth factor levels, different, um, uh, uh, particular inflammatory markers. When they give stem cell treatment and then measure all these levels, the research has been pretty consistent. The levels will go back to the younger state. So that's pretty exciting that you can see, you can measure the particular markers of aging and they all revert back to the younger level. So for anti-aging treatments, I would say anybody over the age 35, you know that you are going, on the downhill side, and you can see it, right, in people's faces, and people can sense it in their energy level, their ability to, do exercises and just their overall well-being and ability to recover. So I would say anybody over the age 35 who want to slow down the decline should consider stem cell therapy.
So, talk to me about treatment. Literally, what does that look like? Somebody comes into the office. Do they get stem cell treatment once? Do they do a series? How far apart?
Really depends on what we're looking for. If you want to do it for anti-aging purposes, I would say do it at least every 6 months. What happens is that when you activate any cells, whether or not you're getting it from your own body or getting it from the umbilical cord, once you activate them, there's a finite lifespan. So they live for about 3 months. And then during the process, they will keep secreting different molecules. A lot of them are packaged in what's called exosomes. So what's in these, what they secrete will have their effect probably for another 3 months. This is why we say, you may want to do it at least once every 6 months. But if you want to be more aggressive, like I am, I do it every 3 months. I always want some fresh new stem cells to be in my body. And I have patients who want to be more aggressive. They want to do it every 2 months, or even 1 month. So you can do that, especially if you wear your body down a lot. That may be a good idea. But I would say for anti-aging purposes, at least every 6 months. But if we're looking at helping with chronic conditions, we're first of all, different people respond at different rates, and different illnesses respond differently. The autoimmune condition may be much faster, but neurodegenerative conditions may be a lot slower. Alzheimer's, Parkinson's, ALS, those will be a lot slower. So the brain repairs, just at much slower speed. It takes longer to see the results and the benefits. So I would, there are certain protocols I use. For example, traumatic brain injury, I often recommend 3 treatments, even though some people can have, incredible results even with 1 treatment. For example, I can never predict. This one patient had liver cirrhosis, was in hospice, so he really didn't have very much longer to live, and he was not a liver transplant candidate. So as last resort, he did a stem cell treatment. And he came to me very, very emaciated, with a big distended belly, didn't have much strength to talk. And I did 1 treatment. And I thought at least I would need another one. I needed to, but then he was doing great. His energy was back. His swelling went down, actually started going down that day of therapy, and went down a lot, actually, just on the car ride back home. And then within a couple months, he went back to his doctor. His liver function was normal. I mean,
No.
yeah,
Wow.
that one really shocked me. So I don't expect miracles like this all the time, but it does happen. So I can never tell. So for some people, they may just need 1. Some people may need 3, or maybe even more. It's depending on their condition. Autism, things like that will take more sessions. So
Let me ask for listeners. So I'm just going to pretend I am one of my listeners and I'm guessing because this comes up a lot as a limiter for them doing the fitness programs that also will help preserve lean muscle mass and bone density. Things like obviously things like arthritis, osteoarthritis, and to the point where they're bone on bone with knee. So is that something that could respond to stem cell?
Yeah, absolutely. So first of all, I want to, just, clarify when people say bone on bone,
Hmm.
it would
Hmm.
be almost impossible not to have a rim of cartilage left. You don't wear down everything. I mean, that's almost impossible. If that's the case, you probably can't barely even bend your knee. So when people say bone on bone, it's really the point of contact when they're doing the imaging. Maybe that part is worn down. There's no cartilage left, but you almost always have a rim of cartilage. Within that cartilage that's left, there are going to be stem cells. And when I inject stem cells into the joint or through the IV route, um, it will stimulate the local stem cells that's within that cartilage to make them work and allow them to divide, to differentiate, right? To form this daughter cell that's going to be a cartilage cell. So when the old philosophy or the old thinking was that I have to give the cells that can form the cartilage. It has to be that kind of stem cells. But that has turned out to be very misguided and has been proven wrong because probably 95 to 99% of the way the stem cells work is by involving the body and talking to the local tissue to change the environment and tell the local stem cells to replicate and replenish the tissue. So it's really not so much of the cells, changing themselves to replenish the tissue. So if you can deliver the cells into the joint or into the blood, they will send signals to the local cartilage or whatever cells that are involved and mount a regeneration attack. And I can tell you, I've seen stem cells work really well to help increasing bone density for my patients, increasing muscle mass, and helping with cartilage growth. For example, there's this one lady. She's actually an like acrobat and a dancer, lots of wear and tear. And she did not really tell me about her knee because I just treated her for anti-aging purposes. And I only gave her IV treatment. But within a couple months, she did a repeat MRI and it showed that her cartilage had regrown, which really shocked her orthopedic surgeon who had never seen anything like it. So it's because we're in this new age of medicine. The old medicine had never seen anything like it. The new medicine is not surprised at all. So, yeah.
Okay, so I want to ask you something. So you mentioned whether you put it into the joint or into the bloodstream. So what determines that decision, which
Um,
you do?
uh, it depends on the anatomy and where, what we're trying to get at. What happens with larger joint is that the best technique is to attack from both ends because the cartilage in a large joint like the knee, the outer 1/3 is nourished by the blood supply. The inner 2/3 is nourished by the synovial fluid. That's in a capsule. So I put something just in the blood, it may get to the outer 1/3 of the cartilage, but the signals. But it's going to be very difficult. It's going to take a very, very long time because there's very little blood, exchange of material within, into the joint space. So that's why it's most effective when you can go from both ends. I think that's missing with a lot of doctors who just want to focus on local treatment. I would stay just locally if this is a young, healthy person who just injured, their local tissue. But for most of the people who come to me for these knee repair, joint repair, they're over 50 and their body has impaired ability to repair. That's a problem because osteoarthritis is not a wear and tear disease. if you look at them wearing and tearing, we are doing that really well when we're 5, 6, 10 years old. We are really wearing down our body. But guess what? You don't have osteoarthritis because your body fixed right up. When you're older, you're not really doing that much. And all of a sudden you got osteoarthritis. Is because your body can't keep up and the body is in a more inflammatory state. So you got to change the environment of the body to help your local tissue to repair. That's why the IV route is so crucial.
Hmm. Helpful. Okay. So when you say into the joint, however, all my mind could think was that sounds painful.
It's not.
Okay, good.
Yeah, my
I
patient.
like you already.
Oh my God, the knee injection, and they said, "What? It's done? You're done?" I mean, they can barely feel it. It's so. I inject myself, and it's really, it's just barely, just one little poke. Yeah, you
Okay.
barely feel it. Yeah.
Sweet. All right. So there's the elephant in the room that I'm thinking my listeners are wondering. So I'm going to go ahead and ask. So how affordable, how accessible is this?
I'm trying to make it as accessible as possible. So, the I know overseas when people go to Panama, Mexico, I think most of them I hear the price is over $20,000, even $30,000. At our clinic, it depends on how the body weight of a person, how old they are, and how severe their health condition is. So generally, I do my dosage based on those factors. And then, at the lowest dose is $7,000, and the highest we usually that's probably as high as we go, and that's about $15,000. So most people fall between $7,000 to $12,000.
Very helpful. And I have to say this just to listeners that while we're recording, although this will most likely be released in the new year, and this is 22, and you're thinking, what am I doing and what's different about this year? I think in gift giving time, when we're thinking about sometimes lavish gifts or even not so lavish, but we end up spending a lot of money on a lot of things that don't matter. If this reduced your pain, if this improved your joy every single day, I have to ask, what is that worth?
Exactly, exactly. I was just telling another patient yesterday. I said I have to thank my mom for teaching me the priority in life, because I grew up in China, and my dad was a professor, my mom was a teacher. We didn't have any money, just like everybody else around us. We had very little money. My mom always said, "We're going to put all the money on good food, because nourishing the body, that's what matters." And you see all these neighbors, other people, they're buying this, they're saving all their money to buy clothes so they can look good. That is not smart.
Mm, you learned from the best.
Yes. Yeah. Thank you, mom.
So this has been so juicy. Okay, you've hinted at this already, but what is the expected role of stem cell therapy in the future? And I think we've got women here from literally all over the world listening. If I'm from the middle of the Midwest, if I'm from somewhere in the Southeast, i- is there a place near me where I can access this, or are we still in a moment in time where someone has to travel in order to get this?
Yeah, so different states are quite different as far as accessibility, but not only that, even if you have stem cell doctors there, are they doing bone marrow extraction or fat? Are they doing liposuction to get your fat, and then getting stem cells from that? That I am not a fan of, unfortunately, because if anyone's interested, I have a video, very detailed, pretty technical video, which is a presentation I've done at different conferences. It's called "Are All MSCs Created Equal?" Because they're trying to get MSCs out, or whatever stem cells there are. Bone marrow has almost no MSCs. Those are mesenchymal stem cells, very crucial. And they're getting very old cells out, whatever your age is. So not only they're not as potent, but they also have a potential to increase tumor growth. Whereas umbilical cord derived stem cells have the report, the consensus is that they are anti-tumor. So there's a big difference. So even though someone is doing stem cells, look at what kind of cells they're using. But if they're using umbilical cord cells, are they using umbilical cord tissue cells or blood cells? Those are different. In our clinic, because I founded also a stem cell company, I was able to incorporate the best of both umbilical cord tissue and cord blood and put it all together, because I believe in kind of including all of nature's intelligence into one product and not play God and decide what I'm going to put in the body. If those are the original stem cells in the birth tissue, I want to put all that into a person to help them regenerate. So it's difficult. Is doctor well trained? I've seen so many doctors who are doing stem cells wrong. They are, putting stem cells, diluting them in a syringe and shooting them into the vein. That is a no-no. That is dangerous because the cells tend to aggregate. They can form a ball, easily producing embolism. And so many doctors, even well-known doctors, are doing it that way, and it's scary. So in our academy, I teach people how to do it the right way and how you need to dilute the cells within certain factors, because otherwise they can enhance coagulation. So you don't want blood clots. So there are a lot of nuances. So the doctor needs to be properly trained. Do they have certificates? Have they gotten any real education, or do they just decide to do stem cell therapy and bought some products from a lab that's courting them? So all these are essential questions. I do have a lot of patients who are flying from different states to come see me, and also from other countries. So I think it's an important investment, and finding the right person, it's going to make all the difference.
Great answer. What an exciting time. What an
Yeah,
exciting time to be, on the cusp of something
yeah.
new and contributing to so many adults and changing the way that we age.
I know. And we are, we're doing video, not only audio, so we don't have the video. I was going to show, because it's funny, your show is flipping 50 and I'm 50. And
Yeah.
I reached 50,
And
but
you look good. You look
I
great.
look a lot younger than when I was 45. That's when I started doing stem cell treatments. And actually, I look a lot better than when I was, probably 41. The change is incredible. I've been doing IV stem cells on myself every 3 months. So we are at a stage that we can reverse aging. And we, what I say is that my goal is to look exactly the same when I'm 75. So I'm really going to freak some people out. And what's interesting is that in the past, I don't care if you're a king or you're a queen of an empire, you are aging, you are declining. When you reach your 40s, you can show, you definitely see the difference. 50s, 60s, 70s. You're going down this train, you're just running downhill, and there was nothing. No matter how much wealth they had, they did not have the tools. But now we have it. You don't have to be rich. You just, yes, you have to have some resources. But I would say, I don't even know how many million people in this country are able to, should be able to do this.
Fantastic. I love it. Okay, listeners, I'm definitely going to link you to Dr. Kong's YouTube channel so you can see her in person. You need to catch that. And your website. Where's the best place that they can find you?
So there are Thea CRM. So it's Thea Center for Regenerative Medicine. So THEA CRM, M says Mary, at .com. So that's where they can find me. Or the Joy Kong MD is my YouTube channel. Just type that in. I have some really interesting videos, a lot of things we haven't covered here about stem cells because there's so many aspects, and I have segments on different things that are quite fun to listen to.
Fantastic. Thank you so much again for being here.
You're very welcome. I really enjoyed our conversation.
And listeners, okay, it's your turn. So I did the best I could. talking for you. But if there's a question that I didn't ask that you'd like to ask, you can reach out to Dr. Kong at her website, or you can leave your questions or comments at the show notes at flipping50.com/stem cell. And what are you waiting for? Let's start flipping 50 today.